Welcome to this explainer. Today, we're diving straight into the mid to long-term outcomes of the MESOCOLIC trial for Crohn's disease.
We'll unpack the methodology, survival data, and clinical takeaways, moving from the trial setup right to shifting surgical paradigms. Section 1, the MESOCOLIC trial, the big debate. Extensive mesenteric excision, or EME, versus limited mesenteric excision, or LME. The core question here is simple. Does extending mesenteric excision actually improve recurrence-free survival for our Crohn's patients? Moving to Section 2, patient randomization. Let's look at the trial's structural rigor to establish its baseline credibility. Out of 162 initially screened patients, exactly 116 met the strict criteria and were successfully randomized for analysis. This randomization gave us two highly comparable cohorts, 53 patients receiving LME and 58 patients receiving EME. Section 3, ER-free survival. This is where we hit the most compelling evidence, the actual survival curves. The data here is striking. The EME cohort shows a highly significant improvement in endoscopic recurrence-free survival. And that benefit definitely persists. For modified ER-free survival, EME maintains a statistically significant p-value of 0.036. Even better, severe endoscopic recurrence was substantially delayed in the EME group, backed by a strong 0.004 p-value. Section 4, postoperative treatments. How does this specific surgical choice impact downstream reliance on advanced medical therapies? We really need to contrast the postoperative medication requirements between these EME and LME management pathways. A p-value of 0.006 proves the EME group had a significantly higher probability of avoiding advanced therapies altogether. EME patients racked up 33.2 person-years without advanced treatments. That brilliantly illustrates prolonged, stable disease remission. Section 5, clinical recurrence. How do all these survival and medication metrics translate into raw clinical recurrence rates? Incredibly, surgical recurrence was literally 0% in the EME group, compared to 4% in the LME group. And overall clinical recurrence? Just 3% for EME patients, versus a much higher 11% for LME. Finally, Section 6, shifting paradigms. Let's talk about how these robust mid to long-term findings impact our current standards. To summarize, extensive excision correlates directly with prolonged endoscopic remission and way less reliance on aggressive post-op pharmacology. So here's the real question. Should extensive mesenteric excision become the absolute baseline standard in your operating room?